Protests over the government's controversial health reforms took place in Hastings and Rye on Saturday. Trade unions, NHS staff and Labour Party activists organised a petition and held a street stall in Hastings Town Centre and later in the centre of Rye. They were all promising to battle for the future of the health service. Activists were wearing blue T-shirts with the slogan, "You can never trust a Tory with the NHS." Unison have called for the Coalition's Health and Social Care Bill to be scrapped. In Hastings, I spoke to Mary Laxton. She's a regional organiser for Unison, and I asked her why the union was campaigning.
We want to put a halt on all the redundancies that are currently happening in Conquest Hospital and DGH, District General in Eastbourne. They're looking again about closing down maternity services. We fought that campaign once. It's now back on the agenda. We're looking at private care, less qualified and competent people and more privatisation. We are not going back to the years of Maggie Thatcher. Between us and Labour and all the trade unions, we're campaigning to keep the NHS public and fit for all.
At the event, I met Dave Haggarth. He's experienced the effect of the cuts in a very direct way. He's lost his NHS job.
And I've had to actually take a job in the private sector with a company that would rival the NHS. I'm a strong advocate of the NHS, but just can't seem to continue working for them at the moment.
So your redundancy is a direct result of the cuts made by the coalition government?
Yeah, money saving that the NHS has been asked to make. My job was one of the ones that went by the wayside.
This week, the Health and Social Care Bill reaches report stage in the House of Commons, followed by its third reading. If it's passed by MPs, the bill will move back to the House of Lords. Michael Foster, the former Labour MP in Hastings and Rye, talked about why he was there.
I hear health service workers come and tell me how tough it is now, how that the wards don't get the same sort of attention that they once did from ancillary services, and that's quite apart. And the most important of all, their abandonment of the Labour campaign to have waiting lists down.
Now, the resources would have been cut under whichever party won the general election. How much different would it have been under a Labour government?
Well, I don't think that is true. We had a programme, of course, of addressing the deficit. That had to be done. The banking crisis was one that was not of our making, but it happened. It's a matter. We are where we are. But the fact is that to reduce the deficit in the way that they are doing, including within the health service, is not just damaging the health service, it's damaging the economy. I mean, just look at the unemployment position.
Doctors and Nurses Group have called on the government to withdraw or amend its health reforms, saying they pose an unacceptably high risk to the NHS. But the government maintains that the bill is crucial in its vision to modernise the NHS. It believes that the service will improve if led by health professionals. Health Minister Earl Howe said that modernising the NHS would both safeguard the future of the health service and deliver a world-class service that will put patients at the heart of everything it does.